All right. Okay. So hello, dearsts. No, hello, dearsts of everyone. Huh? Dears of everyone. Dearsts, hello. Yes, wherever you are in the gender spectrum. Charot. And wherever you are in the Philippines. Charot ito. So welcome to our pre-recorded lecture on the different metabolic disorders, no, and the importance of urine for the detection of these metabolic disorders. All right. So I'm pretty much sure na wala ni siya labot sa inyo hang kompre, pero ato na siyang i-appeal og lecture kay of course it's still part of Strassenger din naman, pero baka lumabas din sa boards ninyo in the future. All right? So again, for this lecture lang, again this is just like an overview and medyo brief lang atong discussion, all right, about the different metabolic disorders, okay? So it's not the in-depth talaga parang intense ganun, no? So we're just going to present kung unsay ahang disease, unsay mga expected urinalysis results if ever na no inana, and unsay mga problem in a way, no. So yes, that's it. And more of this I think will be much it will be more discussed, yes, or it will be discussed more ayan, in medicine if mag-med mo, okay. Kaya in a way po, no, when we process urine na ay mga certain cases good na ay mga sudden changes in the urine that may point to these particular metabolic disorders. All right. So for now, yes, pre-recorded muna. Okay, and wala sa ako nag-show face, no, para po secret pa thrill ganun charot. Para ano po ma-miss mo na ma-miss ko ninyo charot. Okay, anyway, daming chika. So again, this is your urine screening for the different metabolic disorders. All right. So again, we'll start first with what are metabolic disorders, no? So in the past, these metabolic disorders are actually diagnosed, no, or detected through urinalysis. All right. But for now, because of the improvement of our different methodologies, laboratory techniques, no, most of these metabolic disorders have already been diagnosed through the more high-end, well-developed na mga laboratory techniques such as your spectrometry, electrophoresis, and all that. All right. But before, no, it's through these metabolic disorders that we see evident changes in your urine, no. And because of that we detect a disease because of these evident changes in your urine, no. So dira ta makabalo before na murag ay na problema kay iyahang urine na ay something wrong, di ba? True enough, if you remember in the physical examination of urine, in the different abnormal odors of urine, most of them are caused by your metabolic disorders. All right. So in the past, dito sila makadiscover na this particular person has a disorder because of the appearance or odor of urine ba. All right. But again, that was before, no? Urinalysis is good ang main method for the detection of these disorders. But now, since we are already, in the high end part, no, we have already well improved the mga laboratory techniques. We are now more on the different usage of machines and different methodologies, again, such as electrophoresis or spectrometry, as what I've mentioned. All right. Now, these metabolic disorders, what are these? No? What are these metabolic disorders? These metabolic disorders include mga carbohydrate, fat, and protein metabolism disorders. All right. And they're usually characterized by the increased excretion of a normal solute sa urine or the presence of an abnormal substance in your urine. So possible na ay increased lang in number, no? Increase in the amount of excreted concentration sa imong normal solute sa urine, or possible gyud na naadyoy present sa abnormal na substance sa urine. All right. Now, why is it important? Sorry. Why is it important that we detect these disorders? Because again, these disorders can cause death, no, and lifelong detrimental effects such as your mental retardation, no, nervous system degeneration, and again, as mentioned, death. All right. That's why this is important, no, that we perform or that we detect these disorders as early as possible. That is why most of these disorders, no, it can be seen sa mga infants pa lang or sa mga newborns. All right. The evidence or the presence of a metabolic disorder should be made, no, or should the efforts to detect these metabolic disorders should be made as early as possible. So pagka newborn pa lang daan, dapat ma-detect na siya. Because again, in the long run, no, most of the symptoms may appear um, in the old age na, or possible po na it may appear sa it may appear towards the later ages pag sa iyahang pagkabata, no. Pero uh, nonetheless, it must be detected as early as possible because again, it can lead to death. All right. So that's the importance of these metabolic disorders. That's why we have, diba, your newborn screening. I'm sure you're all familiar with that, no? So again, unsa man itong main method na karon for detection of these metabolic disorders? It's through the tandem mass spectrometry. So it's a combination. A double siya na method of mass spectrometry. So MSMS, ayan. And again, this is used to screen for the substances produced in many of the metabolic disorders. For hemoglobinopathy, such as mga sickle cell, no, hemoglobin S, hemoglobin C, we usually use HPLC, isoelectric focusing, electrophoretic patterns, of course, and DNA-based and immunologic-based assays. So it's more on the, I don't know, good, more sophisticated, more well improved na good and high end na mga laboratory techniques. All right, so it's not only focusing more on urine but also more on blood samples na gyud, which are more precise and accurate in a way because again these substances can accumulate in the blood. All right, so they can be detected more easily there sa blood. All right, okay, now we go first for the first type of metabolic disorders, your amino aciduria. All right, now for amino aciduria, na sa pangalan na, no, amino aciduria, so sa ihi sa imuhang patient there is an increased concentration of amino acids. All right. And this is classified into two major categories. You have the overflow type or primary, and you have the renal type or secondary. So for overflow type, as you can see, the difference lang, dears, as you can see, there's an increase in the amino acid in your blood. So hence, there is an increase po in the amino acid in your urine because overflow, no? Ni sobra iyang concentration sa imuhang blood. So therefore, it exceeded the normal reabsorptive capacity of that particular amino acid in the tubules of the kidneys, diba? So hence, it is now released in your urine. All right. So if there's an increase in concentration, increase in concentration in blood, there's an increase in your urine. So that's overflow. All right. More proteinuria, diba? Overflow, proteinuria or pre-renal proteinuria. So same principle here. So example, you have PKU, phenylketonuria, and maple syrup urine disease, MSUD. All right. Next, you have the renal type. So, ang problem here, dears, is sa kidney mismo. So, same gyapon siya sa renal proteinuria, no? There's a problem in the kidneys, all right? Especially sa tubular reabsorption of these amino acids. So, there is a normal amount lang or concentration of amino acids in the blood, but because your kidneys are not working properly, all right, especially in the tubules, in terms of their reabsorption capacity, no, or reabsorptive function, all right, then these amino acids may appear in your urine, all right? So, example of that is cysteinuria and Fanconi's syndrome, all right? And of course, we have this, the inborn error of metabolism, your IEM. So nasa pangalan na inborn error, no? So pag panganak pa lang naan niya, there's already a problem in how this infant or this person metabolizes a particular amino acid or a particular substance, all right? Because again, nga naman, naa siya'y defect sa yang gene, all right? So the infant or the baby or the person failed to inherit a particular gene that codes for a particular enzyme that is needed for the metabolism of this particular substance. All right? And because wala man siya gene na na-inherit, so wala siya enzyme na na-produce. Since wala may enzyme na na-produce to metabolize this particular amino acid or substance, so of course, mo-accumulate siya, right? Mo-accumulate ni particular substance and amino acid and muna siya itong ma-detect na sa atong ihi and sa atong blood. All right? And again, that's the basic principle of your inborn error of metabolism. All right? Wala ka na inherit na gene, no gene, so therefore you don't produce the particular enzyme that is necessary for the metabolism of this particular substance. Okay, so that's the purpose or the meaning of inborn error of metabolism. All right, so we have here a summary. This is from Strasinger. What are the overflow, the metabolic disorders, and renal? As you can see, so overflow inherited. All right, so these are those again that there's an increase in the concentration of a particular amino acid in the blood, so therefore it will appear in your urine. Because again, these conditions, the patient or the infant did not inherit a gene that codes for a particular enzyme that is needed for the metabolism of the particular substance. All right. You have also metabolic. For metabolic, these are again same yapon. Could be there's a problem in the organ. All right. There is a problem. Or there could be tumor such as your 5-hydroxyindole acetic acid that produces this substance. No, so it's metabolic. All right. And renal, of course, as mentioned, there's a problem in the kidneys, especially sa tubules, no, and especially in the reabsorptive capacity of your tubules. All right. Okay. Sige. So that's for the different types of your um, Okay. That is for the different types of your metabolic disorders. Okay. All right. So that's for again the summary. This is from Strasinger. All right. Now we go now to the first type of disorders or first group of disorders, which are your phenylalanine tyrosine disorders. All right. Now for phenylalanine tyrosine disorders, the metabolism of phenylalanine, all right, as you can see, connected siya with tyrosine. So therefore, if there are defects in the enzymes here, nasa gilid, all right, if naikulang, no, if na ay uh, wala, if wala na siya na enzyme, no, of course, the byproducts here, of course, will accumulate. All right. So because again, wala enzyme man na mu form ani, all right, or mu metabolize ani na next product. All right. So as you can see, that's the normal metabolism kaning color blue sa tunga. All right. And these are the metabolic disorders if wala ni siya na mga enzyme. All right. So example, for phenylalanine, if wala siya ni na enzyme, the phenylalanine will be metabolized, all right, and another method, and ang iyahang ma-produce kay mga ketones, no? Example, phenylpyruvic acid. And that is phenylketonuria. So, that ato na siya i-discuss later. All right? As we go along. Okay? So, that's the summary of the metabolism of your phenylalanine and tyrosine. All right? So, we'll start first with the first disease, ayan, which is your phenylketonuria, no? So, phenylketonuria, again, it's considered to be the most well-known of the amino acidurias, ayan. And again, unsa may problema ani dears is again wala siya enzyme or wala siya gene rather that codes for the enzyme phenylalanine hydroxylase. All right? Because phenylalanine hydroxylase based sa ato ang picture, di ba? Siya ang mo-metabolize sa phenylalanine para ma-produce ang tyrosine. All right? So therefore, kung wala siya phenylalanine hydrolase, wala pod siya tyrosine na ma-produce kaya wala may metabolize sa phenylalanine. All right. So again, it has of course a characteristic odor na mousy or musty, okay? And again, it may lead to severe mental retardation. Aside from that, it doesn't, a hang disease, of course, you have lighter skin, hair color, seizures, and susceptibility to eczema. All right. As you can see, di ba, balik tani, tyrosine is produced from the metabolism of phenylalanine. Now, as you can see, tyrosine is also needed to produce melanin. So therefore, if naakay phenylketonuria, you don't have this enzyme, right? So therefore, dili ma-metabolize ang phenylalanine to tyrosine. So therefore, walay tyrosine. So therefore, pod, walay melanin na ma-produce. So therefore, saging ka therefore, the characteristic appearance of your patient with phenylketonuria is lighter skin and hair color because again, wala siya melanin na na-produce. Kaya nga naman, melanin comes from tyrosine. And tyrosine comes from phenylalanine. And if phenylalanine hydroxylase is not present, phenylalanine from the food that you eat or the amino acid phenylalanine will not be metabolized or will not be broken down to tyrosine. So therefore, walay melanin na ma-produce. Hence, the patient or the infant will have a lighter skin or hair color. All right. Now, what are the screening tests? Of course, you have the ferric chloride tube test. What is expected results? Blue-green color. You have the Fenny strip, ayan, or Fenny sticks pala, sorry. Fenny sticks ba ni? Sorry. Oh, yeah. Fenny stick strip, ayan, kani, gray to gray-green na color, ayan. So, usually makita sa urine sa patient, no, or sa infant. And we have here the Guthrie bacterial inhibition test. So, this is parang an obsolete test na. I think it's still being performed, pero this is one of the earlier ways, no, to detect phenylketonuria. So what happens is you use an agar plate. All right, the agar plate is seeded with beta 2 thioenylalanine. All right, so the agar plate here contains again beta 2 thioenylalanine, and this beta 2 thioenylalanine, all right, it will inhibit the growth of bacillus subtilis. All right, now in this agar plate, you put the filter paper, ayan, di ba, katong from heel stick na sample, di ba, sa patient, sa newborn, ayan. Ibutan mo siyang filter paper, dried filter paper, and then you put the filter paper here sa agar plate, all right? In the presence of increased phenylalanine, no, in the filter paper from the blood of a patient, if the blood of the patient contains increased amounts of phenylalanine, the phenylalanine will inhibit, ayan, or it will counteract the action of beta-2 thioenylalanine. So therefore, it will induce the growth of your Bacillus subtilis. So therefore, ang positive, as you can see, ay halo around the strip. Okay, because that's the growth of bacteria, the growth of Bacillus subtilis sa imuhang around the filter paper uh, of a blood that contains increased amounts of phenylalanine. So therefore, if na halo around this, meaning again, ni grow ang Bacillus subtilis. Nga naman, because again, the blood contains increased amounts of phenylalanine. And phenylalanine counteracts the action of beta 2 thioenylalanine, which is found in the culture media. All right? And 'di ba, as mentioned, ang beta 2 thioenylalanine siya ang unsa ni siya ang nag inhibit sa growth sa imuhang Bacillus subtilis. So therefore, kung increase ang phenylalanine, again, gikan sa sample sa patient, it will counteract the action of beta 2 thioenylalanine. So therefore, iyahang ipatubo noon ang Bacillus subtilis munang na ay halo of growth around the filter paper. So ang positive result for PKU, again, there is bacterial halo around the filter paper. That is again the Guthrie bacterial inhibition test. All right. Okay, so that's for the screening tests, all right? And of course, for confirmatory, according to Hendy, it's ion exchange high performance liquid chromatography, all right? So that's for phenylketonuria. Again, the most well-known of the amino acidurias, again, unsay mohang i-take note, it is an a deficiency in the enzyme phenylalanine hydroxylase, all right? Take note of that. So what you need to remember, dears, when it comes to in any there's kani mga screening for metabolic disorders are the enzymes na deficient ang imuhang patient, okay, or ang enzymes deficient ang enzymes na wala sa imuhang disease. All right. Another one imong i-take note when you're studying about the metabolic disorders are the screening tests in the context of medtech. Okay. Pero pag abot sa medicine, I think, of course, you have to remember na the symptoms, you have to remember the appearance of the patient and all that and all that. But for medtech purposes, for me, what you need to take note good when studying about the metabolic disorders, bahalag dili mo gawa sa inyong compre karon basin sa inyong boards, is of course number one, what is the enzyme deficient in your metabolic disorder? Okay, and number two, what are the screening tests? Okay, and what are the expected results of these screening tests for your metabolic disorders? Muna siya mong kailangan i-take note, okay, when you study the different metabolic disorders. Okay, all right, ayan, sige. So that's for okay, that's for your okay, so that's for phenylketonuria. All right, so take note of that, dear. Sa mo na siya ako ang mention. Okay, so take note of those when you're studying um, the different metabolic disorders. Okay, ayan. Sige, so that's for phenylketonuria. Wait lang, dears, na ako i-check. Okay, pasensya, pasensya. Okay. Okay, all right. Teka, dears, pasensya talaga, no? MG. Okay, okay. Sorry, sorry. May chine-check. Okay, okay. All right, sige, tama. All right, so we continue now with the second disease, which is of course still under the phenylalanine tyrosine disorder. Of course, that is your tyrosinuria or tyrosinemia. So this time, ang problema na, dears, is sa imong tyrosine metabolism. So you're negative or you don't have the following enzymes. Depending on the type, you have type 1, which is also known as tyrosinosis and considered to be the most severe. You lack the enzyme fumaryl acetoacetate hydrolase, which is kanisha. This one, ayan. Fumaryl acetoacetic acid hydrolase or fumaryl acetoacetate hydrolase. Ayan. All right. Tapos, number two, type 2, you have the deficiency in tyrosine aminotransferase. Ayan. So, here, tyrosine aminotransferase. This one, ayan. So, you don't have this enzyme. Okay. And lastly, sorry, you have type 3, you don't have para-hydroxyphenylpyruvic acid dioxygenase. Okay. So, that's for this one, ayan, para-hydroxy phenylpyruvate oxidase. So you don't have those enzymes. So of course, it will accumulate, no? And muna sila mo cause og mga symptoms. All right. Before I forget the ideas of phenylketonuria, wala na ako na-mention. That's why it's known as phenylketonuria because ang mga byproducts, ayan, this one, sa phenylketonuria, your phenylalanine again will not be metabolized to tyrosine. So therefore, your phenylalanine will be metabolized in another way, and ang iyahang byproducts are ketones, and that is phenylpyruvic acid. And this phenylpyruvic acid or phenylacetic acid, sila ang ma-produce sa mousy or musty odor. All right? So it's because of these substances, phenylpyruvic acid or according to Brunzel, phenylacetic acid, muna mo produce sa imuhang mousy or musty na urine odor. All right? So before I forget them, muna yung ngalan kay phenylketonuria because your phenylpyruvic acid is a ketone, all right? And siya mo produce sa imuhang odor. Okay? All right. So for tyrosine, ayan, pasensya. As you can see, ang tyrosine muna siya yung mga byproducts, no? Still the same mga ketones in a way. So that's why if ever na I odor gamay, all right? Yeah, so that's for tyrosinuria or tyrosinemia. Now, actually, there could also be a transient tyrosinemia na medyo normal lang, no? Transient ra siya because again, the newborns, pwedeng iyahang liver kay dili pa fully formed talaga or fully developed. So, napa siya enzymes na wala pa na produce to metabolize tyrosine. Okay? So, it's due to immature liver of infants and inadequate liver enzymes to metabolize tyrosine. So, it's only transient, no? But pag medyo mo grow ng infant, all right? So, of course, mo mature na yung liver and to produce those enzymes, makaproduce nato na enzymes. So, of course, mawala ra pod ang tyrosinemia. So this same principle is what is also seen, no, or what is also the principle, or unsay this is also the pathology, ayan, or the pathogenesis of tyrosinemia in cases of severe liver disease such as mga unsa ni cirrhosis, no, mga hepatitis, all right, because again the liver is damaged, so dili siya ka-produce og enzymes that can metabolize tyrosine. Okay, so that's why, diba, remember, tyrosine crystals is one of the crystals seen in liver disorders. Because of this reason, the liver is damaged, okay, so walay enzymes na ma-produce, okay, to metabolize tyrosine. Okay, so again, what is the characteristic odor? Rancid butter urine odor. Rancid butter. Okay, ayan. And here again, if urine specimens are stored in the refrigerator and taken out of the refrigerator, of course, it will precipitate. Okay. Um, Sorry, if it's stored in the refrigerator, yes, it will precipitate tyrosine crystals. Okay, so remember, appearance of tyrosine crystals, iba mga nidos, ayan, it may be black or pwede siyang yellow, golden brown in the presence of bilirubin. Okay, now screening test for tyrosine, tyrosinemia, you have again the ferric chloride test, Japon, positive color is transient green. You could also use nitrosonaphthol, positive kay orange red. And confirmatory test, again, you have chromatography and quantitative serum assay for tyrosine. Okay, all right. Next, you have, of course, Alkaptonuria. Ayan, one of the most common po na Alkaptonuria. So for Alkaptonuria, it's negative for the gene that codes for homogentisic acid oxidase. Take note of that, dears. Ayan, homogentisic acid oxidase. Ayan, take note. It's still in the metabolism of phenylalanine. Now, as you can see, the negative gene that codes for the enzyme again is homogentisic acid oxidase. And because of that, mo accumulate ang homogentisic acid. All right. And this homogentisic acid gives the urine a characteristic color na uh, uh, black, no? Pwedeng black after becoming alkaline. That's why it's called alkapto, no? So alkali loving, no? So therefore, pag mo alkaline ang urine, mahimo siyang dark because of the homogentisic acid. Okay? So from standing at room temperature for up to 12 to 24 hours. Okay. Now again, usually it is first detected from patients or from infants ilang diapers. For cloth na diapers daw, there will be precipitates or mga black or brown na mga staining sa diapers na cloth. Pero katong plastic na disposable, it's color pink. Ayan, pink or reddish stain. So, I don't know unsay ngano dagay na siya na, but nganong inana, but because siguro um but because siguro of the different uh components of the diaper, that's why inana yung color. Basta cloth kay black or brown, and kung katong plastic na disposable na diapers, pink. All right. Now HGA or homogentisic acid, dears, again, iyahang characteristic or iyahang possible na sequelae, no? Your alkaptonuria manggod, usually it can be seen na when patients become 30 to 40 years old. Dito pa siya makitaan ang mga evident na changes. And what happens, your HGA, again, will be deposited, all right, to the different parts of your the different yeah, parts of the body, no, especially in collagen, no, especially in the collagen in your cartilage and other connective tissues. All right, that's why it can cause an abnormal dark blue or black tissue pigmentation and can also lead to arthritis. And this development of blue or black na tissue pigmentation, as you can see, is known as ochronosis. All right, so that's the deposition of your HGA, homogentic acid, to connective tissues and cartilages. Okay, all right. Now take note also, dears, that your alkaptonuria, all right, the urine of patients with alkaptonuria is positive for the Clini test. Okay, all right. Yeah, okay. So your homogentic acid, take note, is a reducing substance. Ayan. So therefore, it will be positive for the Clini test, which is again your tablet test for glucose, diba? Which follows the principle of copper reduction, diba? So again, take note of that, dears. Alkaptonuria, positive for Clini test. So if na mga questions, such as mga exams na like urine is darkened upon standing, like mayroon sa lito na, the urine was submitted to the laboratory, it was color yellow pa. But after some time, it darkened. Okay? And may na positive siya for the clinic test. So atong answer there is alkaptonuria. Because take note, no, there could be a lot of reasons, no, as to why the urine darkens on standing. Diba? We have discussed that sa physical exam. It could be alkaptonuria, pwede siyang melanuria pod, no? Or pwede pod siyang katong other causes such as mga ingestion lang or medications, diba? So we have to differentiate, no? We have to perform other tests, okay? So one of that is clinic test. So kung positive ang urine, nakatong ni darken after some time, for clinic test, then that's caused by alkaptonuria, caused by homogentic acid. Okay? All right. Another test is kanisha. You have here alkalinization. Ayan. Alkalinization of fresh urine. So therefore, because again, alkali lover, di ba? So pag add ni mo NaOH sa imuhang yellow na urine, ni color black siya, so therefore that's positive for alkaptonuria. The urine contains homogentic acid. Okay? All right. So what are the different tests for your alkaptonuria? You have again ferric chloride, Japon dears. Positive siya for transient blue. So transient meaning moagi lang. Ayan. Again, as mentioned, clinic test, positive for yellow precipitate. And of course, you have the alkalinization again of fresh urine. You add 10% NaOH. Pag add mo sa example, yellow urine, yan i-change siya down to brown or black na color, then that is positive for alkaptonuria. All right? Now, for confirmatory tests, again, you have paper or thin layer chromatography, gas chromatography, mass spectrometry, and liquid chromatography, tandem mass spectrometry. All right? And you have capillary electrophoresis. All right? So those are for the different tests of alkaptonuria. What you have to remember, again, unsang enzyme na deficient, homogentic acid oxidase. Another one is ochronosis. Pwedeng na ay darkening, no, ng mga pigmentation sa iyahang cartilages such as sa ears, sa iyahang sclera of the eyes, all right? And lastly, clinic test positive because homogentic acid is a reducing substance. Please take note of that. Okay? All right. Ayan. Sige, that's for alkaptonuria. All right. Next is, of course, melanuria. Ayan. For melanuria, as you can see, it is usually caused by melanoma. No, melanoma are malignant or mga tumor that contains melanocytes. And these melanocytes continuously produce melanin. Okay? Or they produce your 5,6 dihydroxy indole, which oxidizes to melanogen and then becomes melanin. And this melanin now is again deposited or can be seen in your urine. Now, urine darkens upon air exposure. Ayan, darkens upon air exposure. Take note of that. So, muna siya, that's why we have to differentiate kana mga urine that darkens upon prolonged standing, no? Basta kung na-mention dito na upon air exposure, you have melanuria. Pero kung when the urine becomes alkaline, you have again positive siya for alkaptonuria. Okay? So, na mga differences good, no? So, medyo challenging siya. So, basta gani na urine that darkens upon standing, you have to differentiate kung unsay cause ana. Alright? Pero again, when sa exam, gipangutan na siya, na yung mga specific na mga details. Such as I mentioned, alkaptonuria, positive sa clinic test. For melanuria, gi-mention siguro na na-expose siya sa air, ganun. Okay? Alright, so that's for melanuria. Now, of course, if mas dark siya, meaning mas daghan ang melanin na naa. Okay? So if daghan kay melanin na naa, it could be that the urine becomes completely black gyud. All right? And in contrast, if wala po kay melanin na ma-produce, that is again, it causes albinism or whitening, no, lighter skin and lighter hair color, and also eyes. And this is known as albinism, such as sa phenylketonuria, di ba? Remember, di ba, sa phenylketonuria, ayan, wala yung melanin na ma-produce because melanin comes from tyrosine, di ba? And yes, sumuto siya na ay lighter color ang imuhang skin and hair sa mga patients with albinism. Again, wala sila melanin, and also sa phenylketonuria. So what are the tests that we can use for melanuria? Again, you have the ferric chloride tube test pa rin. What is expected result? Gray, black, precipitate. Okay. Another one is your thormalin or sodium nitroprusside test. Positive result is a red color, and you have the Ehrlich test. Positive food is red. Ayan. So um, that's for the expected results sa imuhang melanuria. Okay. All right. Sige. So that's for melanuria. Okay. Alright, sige. Pasensya dear sa may chine-check na naman ako. Okay. Okay, okay, okay. Okay, okay. Charot. Okay. Sorry, sorry. All right, sige. So that's for melanuria. Okay. Next we have so that's for your phenylalanine tyrosine disorders, no? So take note kinsa to sila: Alkaptonuria, phenylketonuria, the tyrosinemia, tyrosiluria, and lastly melanuria. Next group of disorders are the branched chain amino acid disorders, no? So why is it called branched chain? Because this involves the amino acids in which ilahang structure na sila branched na methyl group. Ayan, this one. So example, si leucine, si isoleucine, and si valine. Alright, so this is a normal amino group. Ayan, alright, the alpha amino group. And this is the branched chain. As you can see, branched. No, that's why it's called branched chain amino acid disorders. Alright, so in this group of disorders, there could be an accumulation again of the early amino acid degradation products, such as in MSUD, or there could be an accumulation of organic acids produced further down in the amino acid metabolic pathway. So, pwede siyang katong mga early precursors ang nag-accumulate or katong mga later products na. Alright? So, that's for the branched chain amino acid disorders. Alright. And the very, very popular branched chain amino acid disorder is, of course, your MSUD, the maple syrup urine disease, no? And this is considered to be the most common IEM or inborn error of metabolism in the Philippines. All right. Now, again, for MSUD, pasensya dear. So, okay, all right. Ayan, sige. Tama, tama. Okay. All right. So again, MSUD, this is the most common IEM in the Philippines. All right. Again, the infant lacks the gene that codes for what enzyme? Branched chain alpha keto acid dehydrogenase. I think I think wala tong branched chain diri sa inyohang notes, dears, paki-add na lang. So branched chain alpha keto acid dehydrogenase. For the metabolism of the keto acids or the branched chain amino acid, leucine, isoleucine, and valine. So silang tulo na mga amino acid. And because of that, sa ilang appearance or characteristic odor, nasa pangalan na maple syrup or caramelized odor of your urine because of these products na nag-accumulate. So, nasa pangalan na, no? So it smells sweet, no? Mura siya kanang syrup para sa pancake. Ayan, maple syrup, caramelized sugar, odor of urine. All right? Now, same sa other nimo na mga amino acidurias, dears, or sa atong mga diseases na mention. Usually, ang infants good na pagpanganak na ay metabolic disorder, they appear normal, all right? Pero once they progress with life, dito na mo gawas ang symptoms, all right? So that's why we need, as I've mentioned, we need to detect or we need to perform, Jude, tests to detect these metabolic disorders. Because again, pag panganak pa lang daan, the patient or the infant may appear normal. Pero as they go along sa ilahang life, as they grow older, dito na mo gawas ang mga symptoms. Okay? So, to prevent those symptoms na atong na-mention po na very life-threatening and deadly, we need to detect these disorders as early as possible. All right? So, para sa MSUD, ayan, infants born with MSUD, again, they appear normal. But after pila ka weeks, no, or after, as they grow older, again, there is ketoacidosis because of the accumulation of these products na wala na metabolize. And it can lead to seizures, lethargy. And if magpadayon, of course, it can lead to brain damage and mental retardation and then eventually death. Okay, so that's the overall parang clinical course of your metabolic disorders, no? So infants are born normal, appearing normal, pero pag adto nila or pag pag grow older nila or as they progress with life, dito mo gawas hinahina ang mga symptoms. And these symptoms again are most often life-threatening and can be deadly. Okay, and can affect the brain, mental retardation. Okay, so next for the screening test, dears, take note 2,4 dinitrophenylhydrazine test. So kanang DNPH para kinsa na MSUD. So take note na lang PH Philippines, 'di ba? PH. So kinsa man to pinaka-common na IEM sa Philippines MSUD. So para kakinsa ng 2,4-DNPH or dinitrophenylhydrazine, that is for MSUD. Which is what is the expected result? Yellow turbidity or precipitate, such as this one. Okay, and confirmatory test: gas or thin layer chromatography and nuclear magnetic resonance spectroscopy. Okay, all right. So na-mentioning NMRS, ka-remember ko sa lecture ni Dean, muna siya mong recall sa clean chem, di ba? Katong lipids na murag, sa to yung description niya, na murag non-destructive analysis of blah, blah, blah. So, muna siya, NMRS, Nuclear Magnetic Resonance Spectroscopy, which is also used for MSUD. Okay, so maple syrup, urine disease. Okay, so again, maple syrup, urine disease. Okay. All right. Okay. So the DNPH test is positive because again of the presence of pyruvic acid and acetoacetic acid and alpha ketoglutarate, which are again mga ketone bodies. Okay, that's why which contributes to the odor, no, of your urine. Okay. All right. So sige tag-mention ani day no. So how do we once ma-detect nato ni mga disorders so sa matong buhaton? Of course, because we already know what are the possible disorders or what is the disorder, metabolic disorder of a particular infant, we can modify the diet of your infant because these amino acids are of course found in a lot of food no that we eat. So therefore detection as early as possible can lead to the modification of the diet of the infant as early as possible po. So muna siya atong goal para ma-detect nato as early as possible and ma-modify ang diet as early as possible. Okay, such as for leucine, isoleucine, and valine, they predominate mga protein-rich foods, of course, such as milk, ayan, meat, eggs, and also in flour, cereal, and fruits and vegetables in lower amounts. So therefore, di ba, can be found in milk. Of course, milk is protein, so daghang amino acids. So therefore, sa mga infants na naay mga metabolic disorders, especially kani mga amino acidurias, of course, then milk should not be a food or a should not be given to them with metabolic disorders because the presence of milk or pag inom nila milk, of course, dili nila ma-metabolize correctly. So therefore, na yung mga breakdown products na accumulate which can lead to death, no, or can lead to the symptoms of the different metabolic disorders. Okay, so that's the importance of detection of metabolic disorders as early as possible. All right, so that's for MSUD, the first branch chain amino disorder. Next, you have the organic acidemias. Again, these are the accumulation of organic acids, no, mga later products na of the metabolism of your branch chain amino acids. So generalized symptoms are your, of course, metabolic acidosis, production dyan ng mga ketone bodies, no? Hypoglycemia, ketonuria, and increased serum ammonia. You have three major types. You have isovaleric acidemia, which again has a sweaty feet, urine odor. You have propionic acidemia and methylmalonic acidemia. All right, so it's your methylmalonic acidemia detected using the para-nitroaniline test, which ang positive result is emerald green na color. All right. Now, propionic and methylmalonic acidemias, again, they result from errors in the metabolic pathway, converting isoleucine, valine, threonine, and methionine to succinyl coenzyme A. Because propionic acid is the immediate precursor to methylmalonic acid in this pathway. So, propionic acid mauna, followed by methylmalonic, and then followed by your succinyl coenzyme A. So, therefore, if may problem sa mga enzymes, sa pag-metabolize dito, so of course, ma-accumulate sila. All right? So again, more of the discussion ani dear sa biochem gyud sa inyong medicine. I'm sure i-explain pag ginigtarong dito, no? So, ayan. But for now, kanilang sa, no? So, that's for your organic acidemia. So, accumulation of these organic acids. So, example, propionic acids and methylmalonic acid. All right. So, that's why it's called organic acidemias. Kaya nag-accumulate ng mga organic acids. Again, later na, mga later products na in the metabolism of these amino acids. All right. So, that's for organic acidemias. All right. Okay. Sige. Next, you have the next group are the tryptophan disorder. So tryptophan or tryptophan disorders, all right? Tryptophan, actually, I think it's tryptophan ang pag-pronounce, or pwede po siyang tryptophan. So any pronunciation would be okay, all right? So you have tryptophan or tryptophan disorders. So as you can see, you have abnormal. Most of them, dears, happens because of intestinal disorder. That's why it's called a metabolic, di ba? Dito sa table, metabolic siya in the sense that probably na problema sa imuhang organ. Normal lang sa imuhang enzyme production pero na ay possible problem sa imuhang intestine because normally tryptophan or tryptophan is reabsorbed in the intestine. Okay, per kunai intestinal disorder, there's excess indole, all right, and this indole will be reabsorbed from the intestine into your bloodstream, which again passes to the liver and metabolized to your indican, and this indican will be found in your urine, and exposure to air it will lead to the color indigo blue. All right. Normally, because tryptophan or tryptophan DI is metabolized to indole and released in feces. Pasensya na dears, hindi siya reabsorbed, sorry. So tryptophan normally is again converted to indole and secreted in feces. All right. Now, in cases of malignant tumors, tryptophan, okay, will produce 5-hydroxytryptophan, which becomes serotonin. And serotonin, the byproduct is, of course, 5-HIAA. 5-hydroxyindole acetic acid, all right, which can be detected, which is what we detect in your urine. All right, so that's for the tryptophan or tryptophan disorders. Okay, all right. Pasensya. So again, dili siya normally reabsorbed. It should be secreted in the feces. Okay, that's for indicanduria or for tryptophan. Okay, all right, or tryptophan, something like that. Something like that. Okay, all right. Alright, okay. Ay, tama pala yung na-mention ko, dears. Pasensya. Normal conditions di ay, tryptophan can either be reabsorbed, tama naman, tama na di ay, abalog na sayop ko. It can be either reabsorbed no, by the body to produce more proteins, alright, or converted to indole and secreted sa feces. Ayan. So, sakto na dito. Okay. So, muna siya yung normal metabolism sa imuhang tryptophan. It could be reabsorbed again by the intestine to produce or to build more proteins, or it can be secreted as indole in the feces, no? Or it will be metabolized to indole and then secreted to feces. All right, so depende siya. So, sakto na dito siya. Okay, okay, ayan. So, those are the possible metabolism of your tryptophan. All right, so again, in cases of abnormal conditions such as, again, intestinal disorder and malignant tumors, there is accumulation of tryptophan or tryptophan. All right. Okay, so the first one is, of course, indicanuria. So indicanuria, again, indigo blue ang urine color because of increased indican in your urine. And upon air exposure, it becomes indigo blue. Again, where is it seen? In your intestinal disorders. Again, could be na blockage, na obstruction, no? Or na something wrong. Ayan. And you have heart-nut disease, which is a rare inherited disorder. Okay? So for intestinal disease, of course, such as obstruction or abnormal bacteria, there is increased amounts of tryptophan, which are converted to indole again. And once metabolized by the liver, becomes indican and which appears in your urine. All right. And in the urine, upon air exposure, it will become indigo blue in color. And your heart nap disease, which is an inherited disorder, is also known as your blue diaper syndrome. Because again, of the indigo blue coloration sa imuhang diaper, which is again the conversion of your indican, all right, or upon air exposure. Okay, it becomes indigo blue. So therefore, mo na makita sa patients, sa infants na naay indicanuria or heart nap disease, okay? There is blue, no? Indigo blue sa ilahang diaper. That's why it's called blue diaper syndrome, okay? All right, ayan. Now, what is the screening test? You have the Obermeyer's test. You have ferric chloride Japan plus urine color plus chloroform, all right? So you have, again, a positive result, which is dapat violet, the Obermeyer's test, okay? That's for indicanuria, all right? And the next is your argenta phenoma, all right? Argenta phenoma are also known as your carcinoid tumors. So these tumors usually can be seen in the intestine, all right? These are tumor of the argentaphene or enterochromaphene cells, which are cells in the digestive tract, okay? And these tumor produce serotonin. And serotonin, it will metabolized into your 5-HIAA, 5-hydroxy indole acetic acid, all right? The normal excretion of 5-HIAA is 2 to 8 mg, pero greater than 25 milligrams per 24 hours indicates the presence of argentaphene cell tumors. All right. The test can be performed on a random or first morning specimen. However, false negative results can occur based on specimen concentration and because 5-HIAA may not be produced at a constant rate throughout the day. But take note, there's 5-HIAA or 5-hydroxy-indole acetic acid, 5-hydroxy-indole acetic acid. It's a normal, no, normal byproduct of serotonin metabolism. All right. Um, Ay, sorry. Okay. And in cases lang of this melanomas or mga tumors, they produce an excess, no? In these 5-HIAA. Because excess po ang serotonin na ilang ma-produce. So therefore, excess po ang 5-HIAA na ma-produce as a byproduct of serotonin metabolism. All right? Okay, so that's for argenta phenoma. So mga tumors that secrete a lot of serotonins, which is further metabolized, of course, to 5-HIAA. So here again is an example of a carcinoid tumor. I think sa liver ni siya. Ayan. So again, muna siya cause, no? Sa imong increase in 5-HIAA. Now take note, patient precaution lang, dears. The patient should avoid eating bananas, pineapples, and tomatoes. And I think even chocolates, if not mistaken, because these food are rich in serotonin. All right? So, di ba, serotonin is the happy hormone, tama ba? If I'm not mistaken. So, parang ito yung kailangan mong kainin, dears, para ma-happy ka. Charot. Parang ito yung kulang ko. Charot, tsaka lang. Okay, ayan, sige. So that's for your argenta phenoma, the tryptophan or tryptophan disorders. Okay, so maglaklak na kog banana ni dear. Charot, dears, charot. Tsaka lang so that I can be happy. Charot, para daghan ko serotonin. Eme. Okay, sige. So that's for the tryptophan or tryptophan disorders. All right. Next group are the cysteine. Ayan, cysteine disorders. All right. Now, for cysteine disorders, you have two types, actually three. You have cystinuria and cystinosis. For cystinuria, this is the renal type of the amino aciduria. So therefore, there could be a defect, no, in the metabolism. Sorry, this is the renal type pala. Sorry, this is the renal type of your cysteine disorder. So therefore, there's a defect in tubular reabsorption of the following amino acids: cysteine, and of course, you have ornithine, lysine, and arginine. So cola, muna siya tong mnemonics, cola. No, cysteine, ornithine, lysine, and arginine. Silang upat, defective ilahang tubular reabsorption. All right. Now, cysteine, because iyahang pKa kay 8.3, usually it can be detected in the when the crystals are precipitated or appear in the urine when the pH is less than equal to 8. So pagka-acidic, diba? So of course, these are the cysteine crystals, diba? Remember in our microscopic exam of your urine. All right. Now, the rest of the amino acids, no, they are much more soluble regardless of urine pH. That's why dili na sila mo precipitate. So therefore, ang cysteine na mo precipitate because again, it's less soluble. All right. But for the rest of your other amino acids, sa cola, ornithine, lysine, and arginine, they are much soluble or they are really soluble in your urine regardless of pH. That's why pwede na silang, di sila mo precipitate as crystals. Alright? Okay. Okay. Ayan, okay. And because of its low solubility, ayan, inside the of your cysteine crystals, inside the body, it can precipitate readily as your crystals and even calculi. So here's an example of a cysteine calculi or kidney stone. Okay? So therefore, if na kidney stones, of course, clinical symptoms, hematuria, and abdominal or low back pain. Okay, so that's for cystinuria. So there's an accumulation, no, or there's the presence of these amino acids because na ay problema sa imuhang tubular reabsorption of the following of those amino acids. Again, kinsa to? Cola. Again, you have cysteine, ornithine, lysine, and arginine. Another possible reason for cystinuria is there is a defect in the transport carrier protein of the following of these amino acids. So therefore, di gyapon sila ma-reabsorb sa imuhang tubules. So therefore, they build up in your tubules and release can be found in your urine. Okay? All right. So very important, good dears, is the formation of your renal calculi. Prone kayo sila to the formation of renal calculi. All right? Okay. Ayan. Okay. That's for cystinuria. Okay. Okay, okay. Sorry. Okay. 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 Next, in comparison naman, you have cystinosis. For cystinosis, this is the inborn error metabolism. So there could be a defect na in the enzyme, all right, that is responsible for cysteine metabolism. Or another is there's a defect in the lysosomal storage of your cysteine. Tama ba? If I'm not mistaken. Yes, there is a lysosomal defect, storage defect, no, in the transport passage of your cysteine across lysosomal membrane. So therefore, medyo mo accumulate siya because again, aray, sorry, okay. Because again, wala mo metabolize sa cysteine, okay, or dili siya ma-transport across different membranes, all right? So again, there's a defect in the enzyme responsible, and cysteine, what happens, it can be deposited in many areas of the body, okay? All right. Now, continued deposition of your cysteine results in renal failure, and infantile nephropathic cystinosis, there is progression of renal failure, all right? And in late onset, meaning medyo sa old age na nigawas ang cystinosis, gradual progression siya sa imuhang renal failure. So, dili siya agad-agad. Okay? All right. So, that's for cystinuria. Now, for test cystinosis pala, sorry. So, for testing cystinuria and cystinosis, dears, the first screening test is the cyanide nitroprusside test. Take note of that, dears. Very common na question. Cyanide nitroprusside test. Okay? And that's the brand's modification of legal nitroprusside. And what is a positive result? Red, purple color. All right? Another test is, of course, the thin layer or ion exchange chromatography. And another is your high voltage electrophoresis. So here's an example there. Kung na-arrow mo ni siyang cysteine na deposit. Ayan, para sa ani sa cornea. As you can see, marag na yung mga blebs or marag mga kumpol-kumpol or mga particles na nag-float. That's the cysteine. And then kanisha, after treatment, nawala siya. No? So that's for cystinosis. Okay. For calculi formation, it's rare daw, no? Rare ang pag-form sa imuhang calculi formation or rare ang pag-form sa calculi or kidney stones, cysteine kidney stones imuhang patients with cystinosis. So dili kay siya common. So mas common ang kidney formation kidney stone formation na cysteine sa imuhang patients with cystinuria. Okay? All right. So okay, tama. Yeah, I'm checking kung tama. Yes, yes, that's what I ano. Yeah. Okay. All right. Patients. Uh-huh, uh-huh. Okay, tama. All right. So it's rare because majority ang cysteine daw dears instead of mahimo siyang crystals, ma-deposit siya noon no sa different katong organs na na-mention and pwede po sa tubules sa kidneys. Pwede siyang ma-deposit ito. So it will not become crystals. That's why medyo rare ang imuhang kidney stones na cysteine sa imuhang patients with cystinosis. All right? So that's for the cystinosis. Okay? So take note lang, cystinuria siya ang renal type. Okay? So na defect in tubular reabsorption, no? Of the amino acids cola, especially cysteine. And cysteine, because it's more less soluble compared to ornithine, lysine, and arginine, it becomes it crystallizes no or precipitates out of the solution and can form kidney stones. Okay, and cystinuria mas common ang kidney stones dito. For cystinosis, siya ang amino aciduria na overflow. So there's a defect in the gene that there's a defect no in the gene that codes for the enzyme that is needed for the metabolism of cysteine, okay, or there is also a problem in the transport of cysteine in different lysosomal membranes, so therefore accumulate siya, okay, and be deposited in the internal organs, no, pero rare ang ang kidney stone formation aning cystinosis, all right. And again ang tests for both the cyanide nitroprusside test, take note of that dears, cyanide nitroprusside test, okay, positive result is red, purple color. All right. Next is your homocystinuria. Actually, it's not homocystinuria is not really coming from cysteine, okay, but it's from the metabolism of methionine, okay, and deficiency or defect in the enzyme again that metabolizes or defect in the gene that codes for the enzyme that metabolizes methionine, which is your cystathione beta synthase. Okay, it leads to the accumulation of homocysteine and methionine. Okay, so findings in late childhood include osteoporosis, mental retardation, dislocated lenses in the eye, and thrombosis. Now take note, there's positive po ni siya sa imuhang cyanide nitroprusside test. So to differentiate between homocystinuria and cystinuria, you have to perform another test, which is your silver nitroprusside test. Okay, and the positive result is still red purple color. And this is only positive for homocystinuria and negative for cystinuria and cystinosis. Again, because the three, cystinuria, cystinosis, homocystinuria, are positive in your cyanide nitroprusside test, in order to differentiate, you have to perform the silver nitroprusside test. And para kakinsa ng silver nitroprusside test, it's for homocystinuria, which is positive. Okay, ano say color? Red, purple, color. Okay, so that's for homocystinuria. Okay, so again, there's a defect in methionine metabolism. All right, and unsay defect or unsay kulang na enzyme, your cystathione beta synthase. Okay, all right, that's for the cysteine disorders. Okay. All right. So that's for the cysteine disorders. All right. Yes. So that's for the cysteine disorders. See, balik-balik, Mark. Okay. Now we go na to another major. Ayan, major talaga na category of disorders, which are your porphyrin no disorders or porphyrias no. So I'm sure na discuss ni sa hima 1. Yes. Sana naman. Okay, now just a review na lang. Porphyrins, di ba, these are intermediate na mga precursors, ayan, or intermediate compounds needed in the synthesis of your heme. Okay, so porphyrins, mga compounds needed para sa synthesis of heme. Now, in cases na naay problema, ayan, sa heme synthesis in the sense that kulang og enzyme, naay kulang na yeah, majority yun ay kulang na enzyme, of course, ma-accumulate ning mga porphyrins, all right? Now, the porphyrin precursors, especially porphobilinogen and delta aminolevulinic acid, and the porphyrinogens, uroporphyrinogen, coproporphyrinogen, and protoporphyrinogen, these are all colorless, no? Non-fluorescent compounds. But once you oxidize this, no, or mahimos lang uroporphyrin, coproporphyrin, no, and protoporphyrin, they become sila na mo produce a color, usually dark red or purple, and mo fluoresce po sila, no, intensely fluorescent. All right. Now, porphobilinogen and aminolevulinic acid, aminolevulinic acid, which are the porphyrin precursors again, they appear principally in urine because of their solubility, okay? And they are removed rapidly from the blood by the kidneys. Your uroporphyrin is excreted lang sa urine because of its solubility. Coproporphyrin is sa urine and feces. And protoporphyrin, dears, is sa feces talaga yun because it's the least water soluble. So take note of that. So uroporphyrin, makitaan lang sa ihi ra gyud. Your coproporphyrin, both ihi and sa feces. For protoporphyrin, you have feces ra gyud siya. All right. Now, disorders that result to the accumulation of porphobilinogen and ALA, they present with neurologic symptoms, primarily with neurologic symptoms because these compounds are neurotoxins. In contrast, when porphyrins na gyud, like uroporphyrin, no, coproporphyrin, ang mo-accumulate, then photosensitivity ang major clinical feature because again they deposit sa kidneys, ayan, sorry, kidneys, they deposit sa imuhang skin, and these porphyrins absorb light, all right, and they form mga toxic free radicals, and they cause mga cutaneous lesions or burning sensation with an inflammatory skin reaction. So therefore, basta ug ang mga porphyrin precursors ang accumulate neurologic symptoms because again they are neurotoxins. Pero kung mga porphyrins na gyud like uroporphyrin, coproporphyrin ang mo accumulate, so sila ang ilahang symptoms or major clinical feature is cutaneous, no? Photosensitivity. Okay, photosensitivity. All right. Now, porphobilinogen, as mentioned here, is markedly increased in almost all patients with symptoms of acute porphyrias, and it's not markedly increased in diseases other than acute porphyria. So therefore, because of this, your porphobilinogen can be both used as a sensitive and specific test for acute porphyria. So for acute porphyrias, the best test to perform is porphobilinogen in this sense, okay, because it's really sensitive and specific. Okay. Now, urine color generally for mga porphyrin disorders is of course red, purple, burgundy red, purplish red, and of course port wine. We mentioned that already, diba? Porphyrins, port wine. Porphyrins, port wine. Pero kung colorless ang urine, that's lead poisoning. Your porphyrin deers or porphyrias can be of two types. Di ay limot kong mention. It can be acquired, no, or it can be inherited, such as kani genetic abnormalities gud siya na ay defect in the gene that codes for a particular enzyme, or pwede siyang acquired, such as exposure to toxic chemicals such as lead. Ayan. So, for lead poisoning, ang ihi nimo is colorless. Okay? Pero na-affected na niya ang imuhang heme metabolism. So here's the summary of your heme metabolism. As you can see, you have aminolevulinic acid, ayan. So lead exposure or lead, no, it will affect the enzymes aminolevulinic acid synthetase and ferrochelatase. All right, so muna iyahang unsa ni iyahang i-affect sa lead poisoning or lead exposure. And as you can see mo ni siya ang mga ano dears, precursors na atong gi-mention, the delta amylonavulinic acid and porphobilinogen. All right? Your aminolevulinic acid and porphobilinogen are the precursors. All right? And kani sila dears padulong na diri mga late products no padulong na sa porphyrins. Okay? All right. And here's an example of a port wine color. So mura siya wine, ayahang color no? Or burgundy red or red na color. Characteristic again of a patient, the urine of a patient with porphyrin disorders. Okay, so here's a summary na kung say disorder, unsay negative na enzyme or unsay wala na enzyme niya. So as you can see, ALA, hydratase deficiency, of course, aminolevulinic acid synthase, your acute intermittent porphyria, uroporphyrinogen synthase, congenital erythropoietic porphyria, you have uroporphyrinogen co-synthase, porphyria cutanea tarda, uroporphyrinogen decarboxylase, hereditary coproporphyria, you have coproporphyrinogen oxidase, and variegate porphyria, protoporphyrinogen oxidase. So as you can see, mga enzymes ang deficient. All right. Now for screening tests, as you can see, what are the tests that we can use or we can perform? You have of course, specimen, pwedeng urine, as mentioned, pwede siyang stool, pwede pong blood, and even bile. All right. Remember, di ba, we mentioned na na ubang mga precursors or mga substances na soluble ra sa feces, or makitan sa feces ra, or makitan sa urine, or makitan sa both. So you can use a lot of specimen. You have first the Ehrlich's reaction. It detects the delta aminolevulinic acid and porphobilinogen. Fluorescence at 550 to 600 nanometer. It tests for the oxidative forms na uroporphyrin, coproporphyrin, and protoporphyrin because again they are fluorescent compounds. And you have the free erythrocyte protoporphyrin, which is recommended for lead poisoning. So you're detecting protoporphyrin sa imuhang RBCs. Ayan. So, di ba, protoporphyrin nandito. Okay? All right. Ayan. So that's for the tests for your porphyrin disorders. And again, lead poisoning inhibits ALA synthetase and ferrochelatase. All right? So that's the enzymes affected by your lead poisoning. All right. Pero ang urine sa patient with lead poisoning, again, colorless. All right. Now remember again, Ehrlich's reaction, di ba? Remember, that's why urobilinogen, di ba? We have what we call the Ehrlich reactive substances. Remember sa chemical exam of urine, di ba? So these are the Ehrlich reactive substances na pwedeng mo react sa imuhang Ehrlich's reagent. Okay, that's why we have the Watson-Schwarz and the Hoesch test or the Hoesch test. Okay, all right, ayan. That's for um, the different tests and disorders for your porphyrin mga porphyrias. All right. And this is summary kung sa mga elevated compounds, kung sa ilang mga clinical symptoms and laboratory testing. So for acute intermittent porphyria, you have again ALA and porphobilinogen iyahang clinical symptom. As you can see, ALA, porphobilinogen, di ba? These are all uh, porphyrin precursors, meaning na sila sa first part sa imuhang hemetabolism. And as we have mentioned, di ba, kung sila ang accumulated or sila ang daghan, unsa ang symptoms, neurologic. Ayan, neurologic or psychiatric. Because again, these are neurotoxins. And what are the tests that we can perform? Urine Ehrlich reaction. Yeah, next you have porphyria cutanea tarda, uroporphyrin. Kani mga porphyrin na lang gani dear, so wala na gen, O-gen, no? Kani sila, of course, we mentioned that these are all in the precursor, these are all mga, ano na, mga porphyrins na yun mismo. Like, they are not the precursors na. And once we mentioned, di ba, if kanina sila ang accumulate, ang main clinical feature is photosensitivity. So sa skin, because again, they absorb light. All right? So therefore, yung laboratory testing, as you can see, are mga fluorescents na. Pwedeng sa urine, pwedeng sa feces, because coproporphyrin is both, can be seen in both urine and feces, no? For variegate, na siya neurologic, no? Pero majority pa gyapon is photosensitivity. All right? Erythropoietic, again, protoporphyrin gyapon, photosensitivity. For lead poisoning, as you can see, di ba? Elevated compound is ALA, which is a precursor, and protoporphyrin. For the main symptom is, again, clinical neurologic symptom gyapon. All right. For lab testing, you have again Ehrlich reaction, your blood FEP, again the recommended method by CDC, no, your free erythrocyte protoporphyrin. All right, and Ehrlich reaction. So again, these are your porphyrin disorders, no? So summary lang. Again, what you have to remember lang, dears, are again the enzymes, no? Deficient, okay? And what are the possible elevated compounds, all right? Basta kung porphyrin precursors gani, mga porphobilinogen, alpha aminolevulinic acid ang mutaas. So therefore, iyahang main clinical feature is neurologic. Okay? Pero kung kato na mga later products na mga porphyrins na gyud, uroporphyrin, coproporphyrin, protoporphyrin, these are all photosensitivity or sa skin iyahang symptoms. Okay? All right, take note of that. Lead poisoning, take note here sa, it's colorless urine. Pero pwede siyang mo-fluoresce. Tama ba? Na ba siya fluorescence? I think wala. Okay. But the best test is again your blood FEP, free erythrocyte protoporphyrin. Again, sa ito na enzymes iyahang gina-atake, no? You have the ferrochelatase and your sa to? Ferrochelatase and ALA synthetase. Okay. All right, that's for lead poisoning. That's why before, no, before nawala pa na discover ni mga porphyrin disorders, this is believed to be the diseases of the vampires, 'di ba? Or sila gitong so kato mga patients na nag-exhibit ani na symptoms, they were considered to be the vampire, no? Mga vampires. Remember, symptoms photosensitivity, 'di ba? Photosensitivity, so meaning matakot sila sa light, 'di ba? Vampire. Another is neurologic symptoms, so na psychiatric disorders or psychiatric symptoms. Another is red ilahang mga urine, red ilahang pwedeng mga tissues or mga gums or mga teeth because again of the porphyrins, 'di ba? So very consistent with a vampire, 'di ba? So many believe that ang mga porphyrin disorders or mga porphyrias sila ang or kato mga gi-believe na vampires, they actually have porphyrias, no? So kato mga na vampires before or people that were believed to be vampires before, no, are actually normal people lang pero they have porphyrias, okay, because of their defects in your heme synthesis, all right? And because of their symptoms na mga photosensitivity, red na urine, no, neurologic symptoms, munang mapagkamalan sila as the vampires, okay? Ayan. So, base din tinuod ang vampires, yes, mga baka tinuod si Damon and Stefan. Charot. Mga tiglantaw Vampire Diaries dyan. Okay, ayan, sige. So that's for a brief history lang naman of the porphyrin disorders, mga porphyrias. No? So it was believed before na katong mga porphyrias or wala pa ni-discover ang mga porphyrias, no? These are, or it is believed now actually, na katong mga before, sa historical pa lang, mga early times, no, those that they believe to be vampires, they actually have they are really not vampires pero they actually have porphyrias. Okay? Because again, very consistent ang symptoms sa porphyrias to that of a vampire. Okay? So, ayan. So, that's for your porphyrin disorders or the porphyrias. Okay. Wait, let me check this. Baka may nakalimutan ako ah. Okay ah. Alright. Okay, sige. Ayan. All right. Yes. Take note there, diba? We discussed already, again, the different tests you have again, diba? Your the Watson-Schwarz and the Hoesch test or the Hoesch, diba? So for Hoesch, diba, it's an inverse reaction for porphobilinogen, okay? And positive gapon kay red, diba? And you have the Watson-Schwarz, diba, for uro, for porpho, and the other Ehrlich substances. So I hope na remember pa to siya and I hope okay lang to na nakasabot ra mo ato. Atong mnemonics na medyo bastos. Okay? Pero I hope na gets lang to siya. All right? Very important to dears. Baka lumabas, no? Sa inyong kompre. I really hope na mugawas siya. Okay, all right, sige. So those are all for the porphyrin disorders. Again, porphyrias na ay defect na problema sa imuhang heme synthesis. Okay? And because there's a problem with the heme synthesis, particularly or specifically there is a defect in the gene that codes for a particular enzyme needed for the production or for the metabolism of a porphyrin precursor or a porphyrin substance, then it leads to accumulation, all right, and which leads to the different symptoms. Okay, and it's believed again that those that were considered to be vampires before, all right, they actually have mga porphyrias. Okay, all right, but who knows? They may be lurking there somewhere, some Mystic Falls, charot. Vampire Diaries, charot. Okay, that's again for porphyrin disorders. Next group, you have again the mucopolysaccharide disorders. So for mucopolysaccharide disorders, again, impaired metabolism of the mucopolysaccharides or the glycosaminoglycans. So your glycosaminoglycans are proteins partnered with your polysaccharides, which are usually located in the connective tissues. All right. And inherited disorders of these compounds prevent the complete breakdown of the polysaccharide portion of the compounds, resulting in the accumulation of the incompletely metabolized polysaccharide portions of the lysosomes. Um, of the connective tissues, which leads to increased excretion in the urine. So frequently found in urine are mga dermatan sulfate, keratan sulfate, and heparan sulfate. So mga familiar, no, usually makita nyo siya sa connective tissue. All right. Now, what are the screening tests? Number one, your acid albumin, which is considered to be the most reliable. Positive test is, or positive result is white turbidity. Number two is your CTAB, your cetyl trimethyl ammonium bromide test. Positive is white turbidity. And lastly, the mucopolysaccharide test, or katulad siyang spot test. Ayan, spot test, paper test. Positive is blue color. So take note, there's very important good. Usually mo gawas good sa kaning mga metabolic disorders sa exams. Kay ilahang mga screening test good dears. Like, what is the positive result for CTAB? What is the positive for cyanide nitroprusside? No? Or what detects, or what does this test detects? Ganun. So very, very, inanagin ang question. Okay? Alright, sige. Now, what are the different mucopolysaccharide disorders? Actually, daghan siya dears, no? Pero atong gi-mention ra kay kaning tulo, your Hurler, Hunter, and Sanfilippo syndrome. So for Hurler syndrome, as you can see, your mucopolysaccharide, MPS, accumulate in the cornea of the eye, and there could be skeletal abnormalities and mental retardation present. So nga namang mapil ang skeletal abnormalities because again, there's a problem with the connective tissue, no? Mucopolysaccharide. And of course, accumulation of this can lead to mental retardation. It can affect the brain, all right? For Hurler, that's for Hurler. For Hunter, it's rarely seen in females, sex-linked, recessive. Same siya with Hurler na skeletal abnormalities and mental retardation. And lastly, the Sanfilippo syndrome, what you have to remember, it's only mental retardation. Wala skeletal abnormalities present. All right? So for Hurler, Hunter, how you remember lang duha ka H, no? Hurler Hunter, siya gyud ang skeletal abnormalities and mental retardation. For Sanfilippo syndrome, mental retardation na siya. So HH, your H word, charot, tsaka lang. Ayan. So here's an example of a patient with mucopolysaccharidosis. There's a flat nasal bridge and thick lips, all right? Because again, cartilage, no? There's a problem in connective tissue. There could be mental retardation, enlarged organs, mga heart diseases, because again of the accumulation of the products of the mucopolysaccharide na wala na metabolize. Okay? All right. So, ayan. So, that's for the facial, the expected or presentation, no, of patients with mucopolysaccharidosis. Okay? All right. Sige. Next, you have purine disorder. Of course, for purine disorder, number one is, the only one is your Lesch-Nyhan syndrome. So, there's a defect in the gene that codes for the enzyme HGPRT, hypoxanthine guanine phosphoribosyl transferase. All right. So therefore, HGPRT, as you can see here in the metabolism, HGPRT is needed for the conversion of hypoxanthine balik to inosine monophosphate. Asa magikan ng hypoxanthine sa imuhang adenine. And adenine is part of the nucleic acids, di ba? So that's in the purine metabolism. Also guanine, adenine and guanine, di ba sila mga purine, all right? So your adenine, pag metabolize niya, it produces hypoxanthine. And hypoxanthine will be metabolized by HGPRT pabalik unta sa IMP. And because wala may HGPRT, hypoxanthine will continue to be metabolized by xanthine oxidase to produce xanthine. And xanthine will be produced or will be converted to uric acid. So therefore, wala man ng HGPRT, so tanang hypoxanthine, instead na mobalik diri, alright, padayon siya sa xanthine. So daghang xanthine na ma-produce, so therefore, daghang pong uric acid na ma-produce. That's why, increase mo hang uric acid sa imuhang Lesch-Nyhan syndrome. And according to the appearance, no, what is the expected appearance sa diapers of baby? Orange sand. Ayan, as you can see. And these are mga uric acid deposits. Okay? So kung blue diaper syndrome, kasi yan ito, heart-nap disease. There is indican, no? Increased indican in your urine. Alright? But for orange sand and diapers, you have again you have your uric acid, no? Uric acid crystals, Lesch-Nyhan syndrome. So patients may also suffer from motor defects, mental retardation, and of course, gout and renal calculi. Because again, there is increase in uric acid concentration. Okay? All right, that's Lesch-Nyhan syndrome. Next, of course, you have the carbohydrate disorder. So for carbohydrate disorders, there's a defect yapon in the enzyme that metabolizes a particular sugar, all right? Not only glucose, but the other sugars, all right? So for expected results, of course, negative siya sa glucose reagent strip, pero positive siya for the clean test or the copper reduction test. Why? Because again, your reagent strip for glucose is highly specific good for glucose, diba? It follows the principle of glucose oxidase or double sequential enzymatic reaction. And one of the enzymes there is your glucose oxidase, which is highly specific for glucose. So therefore, for reagent strips sa glucose, it cannot detect the other sugars. Pero for your clinic test, which follows the principle of copper reduction or your tablet test, diba? It detects what happens. It det no, saan naman ako? It detects reducing substances. And of course, these other sugars, except for sucrose, diba? They are reducing substances. So in the presence of or in the presence of copper sulfate, they reduce copper sulfate to copper oxide. All right? And that is a principle of your copper reduction test. Okay? All right. So that's therefore positive sila sa copper reduction test, pero negative for the reagent strip for glucose. All right. Now, melituria is the presence of any sugar in your urine. So, melituria, glycosuria, ayan. So, that's the same raslag meaning. Pero melituria good is the presence of any sugar. Bahalag kinsa na sugar. All right. For glycosuria is the presence of glucose and the other sugar. So, medyo daghan sila, no? Pero for any sugar, melituria. So, masyang generalized term. Ang glucosuria, glucose good ang nasa ihe. So, in a way, interchangeable bitaw sila ng mga terms. So, mura na siya para mas specific. Okay? Now, what is the most important sa mga other kaning mga carbohydrate disorders dears is of course your galactosemia or galactosuria. All right? Now, for galactosemia or galactosuria again, it's the inability of the infant to metabolize galactose to glucose. And because of that, it can be associated with failure to thrive, liver disorders, cataracts, and of course, mental retardation. Because again, it leads to the accumulation of the different toxic na byproduct ni galactose, okay, kaya di man siya ma-produce or di siya ma-metabolize further into the supposed next niya na byproduct, it will accumulate mga galactitol, ayan, mga galactate something. So, sila mga toxic na sila sa imuhang lawas, no? So, muna siya makakos sa imuhang symptoms, no, or simuhang disease. Now, take note that milk is composed of lactose, and lactose is a disaccharide that is composed of glucose and galactose. So, therefore, para ma-detect yun, no, it's important to detect as early as possible yun because again, pag inom sa baby sa milk, pwede na siyang makakos o galactose accumulation because again, milk contains galactose. All right? So, dapat yun siyang maagapan agad-agad or ma-detect agad-agad. Okay? All right. Sige. That's for your galactosemia or galactosuria. Okay. All right. Now, other carbohydrate disorders na medyo benign lang, you have lactosuria, seen during pregnancy again and lactation. Fructosuria, parenteral feeding, and pentosuria, increased amounts of fruit. But again, most of these are benign. Okay? Dili kaya sila mo disorder. The most important is galactosemia or galactosuria. And what are the enzymes absent in galactosemia? Number one is galactose 1-phosphate uridyl transferase or GALT, which is the most common. You have galactokinase, GALT, or UDP, uridine diphosphate, tama ba? Uridine diphosphate galactase 4 epimerase or GALE. So these are the enzymes that can be deficient in patients with galactosemia. And the most common is kaning GALT, galactose 1-phosphate uridyl transferase. So that's for the carbohydrate disorders. Most important good dears is your galactosemia. Okay. All right. That's for okay. That's for your carbohydrate disorders. Okay. So kita matutunlan siya. Anyway, all right. Ayan. Okay. Okay, all right. So that's for galactosemia and galactosuria. All right. Now the last group of disorders are your beta fatty acid oxidation disorders. So nasa pangalan na. So there's a problem. There's a defect in the gene that codes for the enzymes that is needed to oxidize your fatty acids. So therefore, there's an accumulation of fatty acids, and therefore, na may accumulation of fatty acids, there could be a decrease in your cell energy metabolism because again, the further byproducts of your fatty acids dili na maabot sa imong cells. So therefore, there could be a defect in the metabolism, na energy metabolism of the cell. All right. So there's a specific enzyme that is defective, and the most numerous cases are those that have a defect or deficient in the enzyme medium chain acyl coenzyme A, dehydrogenase or MCAD, and the short chain acyl coenzyme A dehydrogenase. No, sila yung pinaka-common, the MCAD and SCAD. All right. Children with MCAD, significant risk of death during the first or subsequent clinical episode of hypoglycemia, and your other disorders or fatty acid oxidation disorders can cause recurrent, pabalik-balik episodes of hypoglycemia. Clinical symptoms include lethargy, hypotonia, failure to thrive, persistent vomiting, hepatomegaly, rhabdomyolysis, and Reye syndrome. All right, so because of the accumulation of the fatty acids, wala na siya na further metabolize, so therefore walay sources imuhang cells in a way to produce fat or to create fat for energy. All right, so therefore there is a decrease in cell energy metabolism. So here's an example, the list no of the different disorders. Ayan. So you have the SCAD and MCAD, most common. There could also be very long chain, no, VLCAD, and you also have long chain, your LCHAD. Okay. You have also carnitine uptake and carnitine palmitoyl transferase. So these are all enzymes needed for the oxidation and metabolism of your fatty acids. So there's a defect in these enzymes and the gene that codes for these enzymes. So therefore, this lama produce. So therefore, accumulate imohang fatty acids. All right. So therefore, in a nutshell, muna siya importance ng metabolic disorders. Because again, your metabolic disorders or inborn errors of metabolism, again, they can cause life-threatening symptoms. That's why we need to address them as early as possible, okay? Para in a way po maka-modify ta sa diet sa imuhang infants. Because remember that majority of these diseases are overflow. No, they're really overflow ng mga type of diseases. There's a defect in the gene that codes for a particular enzyme that is needed for their normal metabolism. Hence, the byproducts or the products will accumulate. All right, and these accumulated products can cause harm to the brain, no, and to the different organs, and can often lead to death. And these byproducts or amino acids, no, na overflow or dili ma-metabolize, they all come from food that we eat. All right, majority of them come from the food that we eat. So the importance of early detection is that we can modify the diet of the infant, okay, so that we can prevent the introduction of this particular amino acid or substance to the body of the infant para dili niya ma-metabolize, okay, or para dili siya makaproduce ng mga toxic substances that can be harmful to them. Okay, all right. So that's for your metabolic disorders. Hence, that's why we have, of course, the newborn screening. Ayan. So you're all familiar with this, no? Ang sa ganitong law, ani nako. Di na ko i-answer karon, ako ni ask again when we meet na ano face to face na online sync session. So again, what is the law in the Philippines, no, that stipulates for the newborn screening, no? Newborn Screening Act of 2004. Nako. Empty laws natin dyan, kamusta? All right. So for the Philippines, initially we have six muna. No, you have CH, congenital hypothyroidism. You have congenital adrenal hyperplasia, galactosemia, PKU, G6PD, and MSUD. All right. Um, Pero we also have the expanded newborn screening na medyo niabot na siya 28 ka disorders from 6, no? Including na mga fatty acid disorders, katong amino acid disorders atong na-mention, organic acid disorders, hemoglobinopathies, pwede na, and also others na mga diseases, no? So expanded na siya, daghan nang pwede, no? Ayan, all right. So here, there's dimension na G6PD na ang pinaka-common. So, among the expanded newborn screening. So, siguro, if ang question kay most common in the expanded newborn, so you have G6PD. Pero kung question kay most common IEM in the Philippines, MSUD lang. Alright? Okay, ayan. So, again, at least, no, the importance of this, dears, is as early as pagpanganak pa lang jud daan ma-detect na ang defect sa baby. So in the long run, we can prevent no the accumulation of these byproducts, accumulation of these toxic substances from these amino acids or whatever mangani that can harm the infant and can lead to death. All right, that's the main goal, good. Why we are detecting this as early as possible to prevent the production of these toxic byproducts no from amino acids from whatever substances na pwedeng makaon sa baby or sa person because again, wala sila enzyme, deficient sila sa enzyme na needed for their normal metabolism. All right? Majority are overflow, as we have mentioned, ng mga diseases. Okay. All right. Okay. So newborn screening, di ba, of course? Alam nyo na yan. The sample of choice is, of course, your heel stick sa kilid sa imuang heel sa newborn. And again, it should be performed after 24 hours of life, but not later than 3 days from complete delivery of the newborn. Okay? Pero if dili siya makakaya o 3-day requirement, pwede siyang it can be tested by 7 days of age. Okay? Pero I think gi-modify siya, dears, if not mistaken, pwede siyang within 30 days, no? Within within 30 rotations. Charot. So si Heaven, 22 rotations. Baka na newborn screening na siya. Sana naman na newborn screening na siya. Charot. Okay. Anyway, check ka lang. Okay. Peace to Heaven. Charot. Okay. So 22 rotations. No? So again, 3 days of age, pwede siyang mabutog 7 days of age sa based on law, based sa akong notes, there is empty laws. Pero I think gi-expand or gi-edit na siya, pwede siya within 30 days, if not mistaken, ha? Alright. Pero again, ang best good is it should be performed within 24 hours of life after delivery, no? Of the baby, of the infant. Okay? So that's for the newborn screening. Again, as you can see sa atong poster, no? It's ano by PhilHealth. Sana naman ayan. So if you have mothers, if you know mothers, if you have mothers, of course, sorry. If you know mothers no na mga lanak pa lang no, try to advocate, try to convince no or convince them good for newborn screening. Okay? All right. Okay, it's best that they can be detected as early as possible. All right? You already know that, and then try po to ano of course educate no, educate the mothers, educate yung mga kaila, no, the importance of your newborn screening. All right? So if na may mga kaila na mga mothers or mga lanak pa lang, especially mga lanak pa lang, no, convince them to have newborn screening. Okay? All right. So makatry mo na dear sa interns pohon. Wala po katry og collect og sample for newborn screening. So of course, 'di ba, filter paper naman na siya, mo siyang i-blot no sa different circle. Wow, katry. Pero makatry dyan mog newborn heel puncture. Okay? So heel stick, ayan. Heel stick na sample, God bless dears. No? Nakatry ko sa Galyares sa Soto wala kayo. Pero sa Galyares nakatry jud ko as in it's quite difficult to collect. Kaya kailangan mo siya paspason because dapat dilin mo siya siging microtainer among gamiton ato usually pero dapat dili nimo siya dili ka sige og touch sa iyang foot sa heel kay pwede siyang mo induce og clotting no mga microclots so samot na sa EDTA so ma-reject siya for CBC so you have to practice ma-practice mo na dear sa naka-experience ko sa una sa Galyares very challenging pero carry naman okay so that's for your newborn screening and of course the metabolic disorders that we can detect using urine and that's the end ayan so I hope na-gets na to siya dears so I'm not sure if inyong lataw ni kaya po ni sa compre pero I hope na-gets lang to. Again, ako ang advice, especially sa board exam years, lumalabas ni siya. So what you need to remember good when it comes to the metabolic disorders, again, what are the enzyme deficient, no? What are the enzymes that are deficient in a particular disease? And what are the screening tests and expected results for this particular mga diseases? So if napay time, I'll try to summarize this na into one notes, parang marupok or makalat notes, parang ganun. Para sa marupok notes sa para di ay, so I'll try to summarize this para easy na lang. Okay, if there's still time. All right. So that's the end, dears, of your urine screening for metabolic disorders. I hope na gets lang. If you have any questions, again, feel free to chat or PM me. All right, and I'll do my best to answer them as soon as I can. All right. So thank you, dears, for watching. I hope you have a great day. All right. And I'll see you in our next no pre-recorded or live session. Keep safe and God bless. Study well. Thank you.